Today we're here to talk about facelifts, necklifts, the different types of facelifts and necklifts, and why we do the things we do. Hi guys, I'm Dr. Elbert Cheng. I'm a board certified facial plastic surgeon and board certified head and neck surgeon. So I specialize in plastic surgery of the head and neck. I've been in practice with my sister at Cheng Plastic Surgery for the last going on 22 years now. And we're in Saratoga, California, and we started in Los Gatos, California. We're going to start out with a little bit of the different types of surgery in terms of face and neck. Prior to doing that, I think it's important to understand some anatomy. We're going to include our friend and companion, Mr. Skull. The important things to know are there are essentially different compartments to the face. There's an anterior compartment that is lateral. Here's a pointer here. So it's lateral to the orbital rim and lateral to your muscles of mastication. This is a major divide between the anterior part of the face, which provides smiling, provides chewing, anything that allows you to move your face. Lateral to that, there is no movement in this area, so we call this the lateral compartment. This defining point is very important in terms of facelifting because in the past, there were a lot of facelift surgeries that dealt with this lateral aspect. So remember, this lateral aspect where there are actually defining ligaments that go from the skin down to the bone, the osteocutaneous ligaments of the zygoma, which the zygoma is the cheekbone right here. And then there are osteocutaneous ligaments that go from the skin down to the mandible. These are true ligaments that hold your face in position. So anything in front of that doesn't move, and anything in sort of around this area doesn't move. But again, there's some movement in this anterior compartment. There are some other what we call false ligaments that attach from the muscle to the skin, but not necessarily to bony structures. Those also hold the skin and everything in place. So when people talk about a mini facelift, they're talking about operating in this area here, this lateral compartment. But if we move tissue here, then there is really no movement of what really bothers you, the jowls. The jowls form in the lower part of the face because the tissues sag and meet up against this true mandibular ligament. So we're not touching that in a mini facelift. You're not touching these true and false ligaments that also allows the tissue to be mobile but also sag as you age. So again, the mini facelift it was a nice fad. It is still done for, I'd say, younger patients for very specific purposes, but their effect is much lower. There are a lot of us surgeons who still do that procedure, and I'm not saying it's a wrong procedure. It's just, it depends on what you as the patient want and expect as a goal and outcome of surgery. And that's the main point of what we do. Our goal is not to fit what we do into what we see you should become, but our goal is to really figure out and try to accomplish what your goal is. The mini facelift is great for younger patients, maybe with limited expectations, who want a faster recovery time. And the faster recovery time is limited to smaller incisions, smaller area of surgery. So thus you can get back to work sooner. When you talk about the traditional facelifts, again, we're not talking about just moving skin. And I think most of us understand that at this point, and hopefully you do as well. It's not just moving skin. If we did that, studies have shown, and over the last century, it's shown that those effects give way very quickly and you lose the effect of the surgery. But there are times that you have to move skin only, but in a facelift in general, you're not doing that. the next level up is what we call a SMAS plication or imbrication type of surgery. So the SMAS is it's a fibromuscular tissue layer, and it's a very important tissue layer in the face because it connects your deeper neck muscles, your platysmal muscles, and what some people call like a turkey waddle, and you'll see drops in the neck. It connects that muscle to what is over your salivary gland, to your muscles that allow your scalp to move. So it's that whole layer of mobile tissue in your face that is deeper than the skin and fat, basically to serve to protect the deeper structures. You can't really exercise that muscle. You can't exercise your platysmal muscle and make it tighter. You can't exercise your SMAS muscle in your face and make it tighter. And you can't exercise your, what we call legalia aponeurosis and your superficial temporalis muscle, which again, all those four things I listed are just one continuous mobile layer. But those are important because they also hold certain muscles in place of the face. Around the eyes, the orbicularis oculi muscle is not really attached to bone. The muscles of the mouth are not really attached to bone. But again, they're attached to that main mobile highway that helps to support and protect the face. So getting back to that second type of facelift, the SMAS, we're imbricating in, we're moving that muscle, but it's in the lateral aspect of the face. So again, we're not disturbing any of the major true ligaments and structures of the lateral part of the face or the false masseteric ligaments. So that technique is also useful, but it's useful in very specific types of patients and how they're aging. Again, it's less intensive, it takes less time to do, but there's less effect too. And for our practice, we were trained on that because that was the main type of facelift that we were all doing. This was 10, 15 years ago. And then there's been a transition towards what we call an extended sub-SMAS facelift approach. Some people call it a deep plane facelift. The main point to that is, again, going back to the ligaments that we talked about. Mandibular osteocutaneous ligament, zygomaticus cutaneous ligaments, anterior masseteric ligaments. There are ligaments in the temporal area too. This line of ligaments holds the face in place, but in extended SMAS, we're going under that muscle that I was talking to you about, the neck, above the salivary gland, the SMAS, under that SMAS muscle, under even the galea aponeurosis or the superficial temporal parietal fascia. We're moving that whole area and freeing it up and lifting that fibromuscular tissue. That is what truly gives you kind of advancement of tissue and cleans and refreshes your face. But again, not everyone deserves that type of facelift, but it is a very important part of what we do in a very specific aging process.